welcome to the Art of Being Human. Today I decided that I'm going to do a segment, maybe 2 segments on menopause, because menopause is something that most women go through. Some people have an easy time of it and they can kind of slide through it. Other people have a terrible time with it and they have terrible symptoms. The symptoms are simply awful and they need to be treated for it. So I'm just going to kind of work up to a talk about some of the hormones that we have and what happens to them and what happens to women as they age. There are 2 points I want to make out first, and one is that we have 2 things going on, and unfortunately they're going on at about the same time. One of them is the menopause, and the other one is midlife crisis, and I think they get confused together, but I also think they're 2 separate situations. So let me talk about menopause for a few minutes first. Later on we'll get to the charts that I prepared. Menopause occurs in midlife, usually around 50 to 60 or 45 to 55, somewhere in the midlife of an individual, when the hormones that they have, which is progesterone and estrogen, just gradually fade away and the cycle gradually fades away. And it's basically a hormonal change, but it has really important psychological and physical aspects to it. Men also have menopause, although you don't hear much about it, but they do. And the reason they do is their hormones are also backing down. But the difference is this. In the female, the change of the hormones, the way that it lessens, the production lessens, happens more dramatically and faster than in a man. In a man, the hormone change is a lot more gradual. And when it's gradual, the body has a chance to adjust to the symptoms, adjust to the change, and then you don't have so many symptoms or you have milder symptoms. But I have known men who have had symptoms that are bad enough that they actually have to be treated for it, some of them even getting hormone shots. With women, though, the change is more dramatic. It's faster, and the change in terms of the hormones is faster, the lessening of the hormones. The body expects estrogen. The body wants estrogen, and the pituitary gland is paramount in the process of making the ovary secrete estrogen and also ripen an egg so that pregnancy can occur. But this is like a lifelong process that goes on month by month in women, and it just kind of dies down. You do have a period of time that's called the perimenopause. Perimenopause is a stage of life that's preparatory to the menopause, where the hormones are changing. Women tend to notice that they are having some symptoms, but not severe enough that they're complaining that they have to be treated for it. Now, when people are treated for menopause, a lot of times, what will stop the symptoms is estrogen. If you have your uterus removed as a female, you're not going to get a lot of menopause symptoms. But if you take the ovaries out, the ovaries produce the estrogen, and it's the lack of estrogen that causes you to have the terrible symptoms. So if the uterus is gone, but the ovaries stay, there's not going to be that much of a hormonal change. You will go through the cycle, but you won't be shedding anything monthly as you do if you have the uterus. But if you are having the ovaries removed, then you can have terrible symptoms. So I want to go on with this. I'm actually going to do this in several sections here. Now, the midlife crisis, I want to mention that it goes on at about the same time as the menopause does, so I think the 2 become conflicted together. But midlife crisis is when you are reevaluating your life. Say you are graduated from college, you had a career in whatever area that you had your career in, and you get to be about age 40 to 45. You start thinking, you start reevaluating your life. It's a natural process. Most people go through it. You know, some people don't, they just go right by it, but most people have a period of years in which they're reevaluating themselves. And the questions that they ask themselves are, have I reached the goals that I want to reach? Have I reached the goals that I set to myself when I graduated from college? I've been in one career for about 20 years. Is it time to make a change? Maybe I don't want to do this anymore, whatever I'm doing. I know a guy who's a doctor. He's a well-known doctor. He was a gynecologist. He was very well liked. He got to midlife and he says, I don't want to do this doctor thing anymore. He bought a farm in Maine and he became a farmer. Gave up his medical practice, just moved on and became a farmer. And you know, you wonder, why would a person do it? Because after all, they have a good thing going, the practice is healthy, they have a lot of patients. But how much can you drive yourself to do something before it kind of kicks back at you and your body says, no more, I can't take this anymore, there's too much stress, there's too much work, I want to be in a situation where I can relax, I don't have to be in the forefront anymore. And at that point, they make midlife career changes, as the doctor did. So we get the midlife crisis going on in which you're evaluating your life, maybe changing your career to something that you've never done before, but that you've wanted to do, but you didn't do it because you wanted to pursue your career. Then it comes to the point where maybe it's time for me to make a change and I'm going to do something that's completely different than I've ever done before, and I'm going to relax with it. You hear people talking about that. That's the midlife crisis, but it occurs about the same age as the menopause does. The way the two get conflicted together is the fact that if you're having menopause and your hormones are slowing down in their production, you may have a lot of symptoms of nervousness and anxiety. That's a part of the process. Sometimes it's severe and must be treated. Sometimes you just put up with it, but you're not comfortable, and it changes who you are. See, I think emotions are such that they're not just feelings, they're a state of being. And if you're in midlife and your state of being is to have a lot of anxiety, excuse me, and you're questioning what you've done, if you've made your goals, if you've satisfied your life, if you want to do something else that's simpler or different, maybe not even simpler, but different than what you did before, because after all, you just want to have a different kind of life. You need to start on something new and change things because you have a need to do that, a psychological need to do that, and then you're forced to face the fact that you're nervous, you're anxious, you get dizzy a lot, you can't sleep well, you're just confused about things, and you're going through hormonal changes that give you those symptoms. And I think having those symptoms in the menopause or change of life, maybe change of life is a better term, I don't know, but if you have those symptoms in the change of life, it's going to make you wonder, why am I having these symptoms? Because you may not think of it as hormonal change to begin with. You may think of it as something's wrong with my life and it's making me nervous. Something's wrong in my life and it's making me aggravated and my moods are changing, and it's all because of what I'm doing as a career, and they don't link it to hormonal change. So then they start questioning their career. Is it what I really want? Maybe it's different. Maybe I didn't meet my goals. Maybe I want to try harder to meet my goals. Or maybe I want to change my goals and do something completely different. It's a massive change of life, not only in terms of your hormones and your physical body, which is changing, but in terms of your life as a person, who you are, what you want to define yourself as. And a lot of people define themselves as their symptoms, and that's really a critical mistake. If you're having symptoms of menopause or hormonal change, then you need to realize that the hormonal change, although it's a part of you, doesn't have to define who you are. You know, I had a friend of mine who had a stroke. He was a man. He was elderly. I kind of took him under my wing. We were friends for a long time. And he had a stroke on July 4th. It was a holiday. That's why I remember the date that he had it. He went to the hospital. He stayed in the hospital quite a while. His mind was clear as a bell. It didn't affect his mind at all, but he couldn't talk right. And he had trouble getting his words out. You had to kind of interpret what he meant by what he said because his words were not clear. And he used to cry a lot. when I was up to see him, and I saw him sometimes nearly every day, the hospital was very close to where I was living, and I just would talk to him, and he would try to talk to me about how he felt about things, and he couldn't quite get it out. And finally, he was crying about it, because I'm pretty good at interpreting what stroke patients say. Usually, even if they can't talk clearly, I can figure out what they're saying. And then they say, do you mean this? Or do you mean that? Oh, yeah, yeah. And they'd nod their head. But he was upset about that. And I had an idea. So once when I went up to see him, and I saw him frequently, I said, Paul, that was his real name. He's passed on now. But I said, Paul, I know who you are. You are not your symptoms. Do not identify yourself or define yourself as your symptoms. You are a real person. You are not your symptoms. Try to separate yourself. It's hard to do. It's very hard to do, but instead of thinking of yourself as symptoms, think of yourself as the real person that you've always been. You have the symptoms, but you are not your symptoms. And I explained that as clearly as I could, and he caught on. As I said, his brain was really good. I mean, it did not affect his thinking at all. And then he started smiling, and he stopped crying. I never saw him cry again, because he finally got the message that you don't identify yourself with your symptoms. You know, if you have a broken leg and you're on crutches, you don't define yourself as the person with the broken leg. But when you have something that affects your mind and you have symptoms because of what's going on in your brain, you tend to identify yourself with that and think of yourself as being the person with the symptoms, even though you're not the symptoms. So if you are having a struggle because you are having menopause or some other mental difficulty that makes it hard for you to see who you are and understand who you are, remember, try to separate yourself from your symptoms. You are not your symptoms. If you're arthritic, you are not your pain. You know, if you're having mental difficulties, you are not your depression. You are not your anxiety. You are you. A person that God created, a person that has integrity because God has given it to you. You are you. And the symptoms just are there, and they have to be managed and they have to be treated. So if you can think of that, that'll help you to get through. It'll even help you to get through the menopause. So it is difficult sometimes to realize that there are two things going on, the midlife crisis and the menopause at the same time. And I think most people consider it all to be menopause. I need to make a change in my life, and it's menopause. You know, some people slide through menopause and they don't have a problem with it. I would say most people have some symptoms. A lot of people just have hot flashes, or they just have chills. You can have both that maybe alternate back and forth. And I know if you read the literature, if you read articles, they'll say certain medication will help you with your hot flashes. But they forget there are so many more symptoms like that than that. If you're having a bad menopause, you can be dizzy. You don't see as well because your vision changes. You know, you have the hot flashes, you have the chills, you have anxiety, you have depression. And, you know, people say, and if you read in the literature, it'll say that menopause does not cause depression, except I disagree with that. I've just seen too many people who are menopausal that have bad depression, and it needs to be treated. And the way to get out of it quickly, of course, would be to take estrogen, because estrogen, the lack of estrogen is what's causing all of those symptoms. Unfortunately, estrogen causes cancer. And when it causes cancer, you can't take it. Now, some doctors will give it under certain circumstances. The other thing to remember is that if you're young and you had to have your ovaries removed because you had endometriosis or some other kind of illness, you will go into an immediate menopause once those ovaries are taken out. If you have the uterus removed and the ovaries stay in, you don't go through it because it's the estrogen from the ovaries, or the lack of it, that causes the menopause to begin with. But there's a whole thing that's going on with the pituitary gland. The pituitary gland will secrete a hormone. It's called follicle stimulating hormone, FSH, and this tries to get the ovary to produce an egg. And it also causes the ovary to produce estrogen. And then if the ovary can't do it because it's slowing down, it's beginning to fail, and remember you have two ovaries, one on each side of the uterus, I'll be showing that to you later, and if that happens and you don't have the ovaries producing, then that follicle stimulating hormone is constantly being produced by the pituitary. One shot didn't do it, so let's try 2 or 3. More and more of the FSH gets into your system as the pituitary is trying to get the ovary to respond. But the ovaries can't respond, or they're slowing down. So you get an overload of that FSH in your system because the ovaries can't produce the estrogen that you need. And that's basically the physiology behind the menopause symptoms. You could get rid of the menopause in 2 ways. Take out the pituitary gland, you know. If it's not there, it's not going to produce the FSH, but that's dangerous surgery. Nobody's going to do that. The other thing would be to take the estrogen. Now, where estrogen causes cancer, I'm not so sure about it, but this is what they say. Estrogen causes cancer. I can remember many years ago where estrogen was considered to be a cancer preventative, and where women were routinely given estrogen to stop cancer, to improve the menopause so they wouldn't suffer the symptoms. So there's been a big change. Now they don't want to give estrogen because of cancer, but that wasn't always the way it was. When I was younger, they were giving estrogen shots and pills. And that would stop the symptoms, and they thought it would also prevent cancer. So who's right and who's wrong? I guess it depends upon your point of view and how much research has been done. So there is an emotional aspect to menopause as well. I had a friend of mine who's a teacher. We taught together in the same school system close to the Canadian border. And she had gone through the menopause. She wasn't having a cycle anymore, and she was doing fine with that. Then her husband unexpectedly died. And it was such a shock to her system that the menopause left. She went back having a regular cycle like before the menopause, and it lasted for 3 years. And then she stopped again. So it's like the body got recharged to continue with the cycle, monthly cycle, because of the shock that she had in losing her husband unexpectedly. So there are emotional components to it. Now, some women has an easy time, and they don't have many symptoms at all. They are the fortunate ones. Some people have a few symptoms, but they don't have a lot of symptoms, and they can manage it. Usually you have depression and anxiety involved, nervousness, dizziness, and so forth. If the woman has surgery to remove her ovaries when she's young, then she will go into an immediate menopause, and it'll be severe. Because when you're young, in your 20s, you might have an illness in which the ovaries have to be removed. And if that's the case, your body is screaming for estrogen. It's not normal not to have it in your body until you get to an older age, and then gradually it just slows down and slows down. The more gradual the change, the easier it is, because if your body has a chance to adjust to a slow change, then you're not going to have the extreme symptoms that you can have if you have a much drastic change in the ovaries. I know my mother, and it can last for years, the menopause can last for years. My mother died at 91 years old. She was very long-lived. She had hot flashes up through 90 years old. and every so often she'd go to the doctor. Her hot flashes were bothering her again, and he'd give her a little hormone pill. You know, he would give her a prescription for a few hormone pills, not very strong ones. It would take the hot flashes away, and she'd be fine until the next time it happened. These changes, midlife crisis, menopause, these changes in your system, they last for a long period of time, a very long period of time, with some people longer than others. And so when you think, I remember seeing a show, it's a comedy show, and the woman was having menopause symptoms. And her husband said, well, I'm going to have to move out for a week or two until you get over this. A week or two is nothing. You're just getting started. It can last for a very long time. But it's the removal of the ovaries that cause for the major symptoms. I'm going to read off the symptoms. I'm going to go over it again when we get to the charts, which will be in the next segment because I'm spending so much time on this introduction. But here we have some of the symptoms: severe anxiety, severe depression, tearfulness, a lot of crying, poor concentration, the memory's not as good. You may feel like you want to scream when you're in a store because you can't stand the crowds. The vision can be blurred. There can be dizziness. Some people have to be constantly active. They have to be constantly doing something. They can't sit down and be quiet. It's got to be rush, rush, rush. That, believe it or not, is one of the symptoms. Passing out. Some women will pass out, but I'm not saying it's common. And sleeplessness. A lot of people have problems with sleeping. Now, there are also related conditions that you might not know you have that occur. The bones lose calcium. You get osteoporosis, which is brittle bones. You have blood pressure that rises. Fats in the blood increase. Atherosclerosis, which is a fats in the blood system and in the arteries, coronary heart disease, and stroke. That's a lot. You might not be aware of some of the other things that I mentioned because you wouldn't necessarily have symptoms. Now, not every person has all of those symptoms. Some people have a few, some people have a lot. Some people have almost nothing, some people have almost all of it. If you have almost all of it, it really does change who you are. Now, I'm going to continue with this next segment. We're about out of time. I'm going to be showing you some charts. I'm going to show how the neurotransmitters get involved, and we'll perhaps finish with this segment of the show next time. So please join me then.